The NC Prevention Partners Zone Health Program has trained schools across the state of North Carolina in becoming healthier school environments for childhood obesity prevention. Today we are visiting Thomasville Primary School to learn from their successes.
We're not educating just a little brain that gets to come to school during, between 8 and 3. It's the whole child. Good nutrition, physical activity, physical education, that whole package.
We're going to count by fours. Let's practice 4, 8.
What we first established was a system-wide wellness council, and we have representatives from every school.
Mary Jane helped us in the creation of our wellness policy, and when the policy came out, then we as administrators had to help our staffs to understand how to implement the policy.
We have a school nurse, we have a counselor, we have a teacher, we have a PE teacher, we have someone from child nutrition. They're people who are passionate about health and wellness, and people who came out and said, "This is awesome, I think this is so important."
When I came out to the playground in the beginning of the year, I saw some kids not active, and I saw some kids not participating in things they should be participating. So we worked with Mary Jane, and having the big wellness committee has helped us get these grants. So now kids have opportunities outside of PE. We have more things coming for them.
They stuck to their plan day after day, diet and exercise at work and at play.
Those teachers and staff members who have been involved in the Staff Wellness Challenge and really taken an active role in that are our strongest supporters when we look at doing things for students.
Good job.
These children are supposed to be active for at least 30 minutes a day. So we exercise together as a whole class, and I think being a role model gets them up and active.
We're celebrating being physically fit.
8, 12, 16, 20,
24, 28. That's great. You're great. Okay.
I think our breakfast program is wonderful.
Taking your phone
Our day starts off in a very family atmosphere where everyone has breakfast together. Breakfast is offered for all of the students, so we make sure that everyone starts their day with some good food.
Some of these children just aren't exposed. They aren't exposed to fresh vegetables or anything new. It's an opportunity. We have a great opportunity to get them used to different items, and they do. Some days we fix 300 salads, and that's unusual for this age group.
We have some great community partners. Our hospital is a great partner, helping us get things that we couldn't do otherwise. So a lot of what I do is try to bring in outside resources like North Carolina Prevention Partners and Zone Health.
People will do almost anything if they are personally asked to do it, which definitely it takes time, it takes people to do that. But I do believe parents want to be involved.
Yesterday was Monday. We would have gone to PE. Today is Tuesday. Where do we go today?
I don't have a big budget. I don't have a lot of money to work with. It's a matter really to me of helping the teachers and the principals see that it doesn't necessarily cost a lot more money. It doesn't necessarily have to take time from teaching, but we can still carve the things out of a day so students can get good nutrition and physical activity.
January, February, March, April, May.
We absolutely have to educate the whole child, and we've known that for many, many years, but I think we're taking it on in a new way now. The brain research all says that children need physical activity in their day, and we can't continue to have academics hour after hour for children without having those breaks to help them process and to get them actively engaged, get their minds working. The research also shows that kids need time to process, and that having those breaks and adding some physical activity into our classroom helps them to be better learners.
30, 35, 40, 45.
think it's very possible for other schools to do it, and you take it in small amounts. None of us can undertake anything in a very large way each year, but each year you can improve on what you're doing.
We want to thank you for joining us today at Thomasville Primary School. If you have any questions or want more information, you can contact us at www.ncpreventionpartners.org.